Hello and welcome to Crack the Boards. In today's video, we'll focus on USMLE questions related to histology and cell biology. Let's have a look at the first question. A 62-year-old man with a long history of poorly controlled type 2 diabetes undergoes surgery to treat a persistent leg ulcer. During the procedure, the wound edges are carefully scraped and the necrotic tissue at the ulcer's core is meticulously removed. The surgical team performs thorough irrigation and removes all non-viable tissue. Following this, the wound is dressed and treated with a topical antimicrobial agent. In the post-operative period, which clinical signs during a physical examination would suggest that the wound is healing well? A. Fibrotic edges with a leathery texture. B. Granulation tissue that bleeds to the touch. C. Pale granulation tissue that does not bleed. D. Presence of yellow malodorous discharge. E. Punched out lesion with a firm base. The correct answer is B. Granulation tissue that bleeds to the touch. Pink-looking granulation tissue that bleeds to the touch is a good sign of wound healing. The bleeding is caused by leaky capillaries in the granulation tissue and is a sign that healing is in progress. Let's have a look at why the other options are not correct. Option A is incorrect because fibrotic edges and a leathery feel both indicate that the ulcer is not getting adequate blood supply, probably because of diabetic peripheral vascular disease. The ulcer will not heal in this case, and the wound margins must be freshened again. Option C is incorrect as pale ischemic granulation tissue that feels firm and does not bleed is not considered healthy granulation tissue. Such tissue is usually excised. Option D is incorrect as presence of yellow malodorous discharge is a clear indication of infection. Unfortunately, diabetic ulcers frequently become infected because the tissue is rich in glucose that bacteria utilize. Such an infected ulcer will not heal without intervention, which would require antibiotics and in some cases even debridement. Option E is incorrect as a healing ulcer has sloping edges with a blue line of epithelialization that proceeds from the periphery to the center. A punched out ulcer is an indication of failure of the reparative process, often because of vascular insufficiency. Let's have a look at the second question. A newborn delivered at 28 weeks gestation is transferred to the neonatal intensive care unit due to increasing respiratory distress and later dies from the condition. Autopsy of the lung specimens reveal an amorphous eosinophilic layer covering the alveolar surface. This pathology is caused by the absence or dysfunction of which cells? A. Alveolar macrophage. B. Goblet cell. C. Type 1 pneumocyte. D. Type 2 pneumocyte. The correct answer is D. Type 2 pneumocyte. The micrograph illustrates hyaline membrane disease caused by surfactant deficiency. Type 2 pneumocytes are large rounded cells that produce the lipid and protein components of surfactant. In premature infants, the type 2 cells are immature and do not produce adequate amount of surfactant. The alveoli collapse upon expiration from their own surface tension and become damaged during reinflation. Let's have a look at why the other options are incorrect. Option A is incorrect as alveolar macrophages are not responsible for the production of surfactant. Option B is incorrect as goblet cells produce mucus, not surfactant. Option C is incorrect as type 1 pneumocytes are squamous cells that line most of the alveolar surface area and form part of the minimal air-blood barrier. Their surface is covered by surfactant, but they do not produce surfactant. One of the clues which we get in this question is the gestational age of the newborn mentioned, which is mentioned 28 weeks. In 28 weeks, usually they develop respiratory distress syndrome because of the lack of surfactant, the deficiency of surfactant produced by the type 2 pneumocytes. Let's have a look at the third question. A 20-year-old woman was trapped in a fire and rescued by firefighters. She was transported to a hospital's emergency department with a burn unit. Upon examination, the patient had leathery, non-blanching, burnt skin covering her torso. Third-degree burns severely damaged tissues in which layers of the skin? A. All layers of the epidermis. B. Dermis and hypodermis. C. Epidermis and hypodermis. D. Epidermis, dermis, and hypodermis. Now the correct answer is option D, epidermis, dermis, and hypodermis. These three layers are involved in third-degree burn. In this slide, I have shared a visual illustration so that it will help us remember the different layers of the skin involved in each degree of burn. By associating each degree with a clear image, we can easily differentiate between them and understand the severity based on the layers affected. This concludes today's set of questions, and thank you for watching. If you enjoyed the video, please don't forget to share and subscribe to this channel.